I now recognize the ranking member, Ms. Stansbury, for her opening statement.
Good morning. I want to first start, Mr. Chairman, by welcoming our witnesses. Thank you for traveling many, many miles to come here today and to share what is happening in your communities and to share about these difficult issues. For me, this is a very personal issue. The fentanyl crisis is not a partisan issue. Opioid addiction, the ways in which it's touching down in our communities, does not know any political party. In 2019, my life was personally changed forever when one of my oldest friends died of a fentanyl overdose. And I was serving in the state legislature at the time, and I will never forget the morning that I got the call. For a lot of people who haven't experienced it personally, they don't know what it looks like. The crisis began, we know, in this country with general drug addiction. It increased dramatically with overprescription of opioid drugs in our communities. And now with the vast numbers of opioids and fentanyl coming into our communities, it means that fathers, grandfathers, mothers, aunties, and dear friends are dying every single day in our communities. And nowhere is this more apparent than in New Mexico, where the fentanyl crisis is literally ravishing our communities. I know these are difficult issues to talk about, and I deeply appreciate our tribal leaders who came here today to share those stories. And I implore my colleagues across the aisle to not turn this hearing into a partisan hearing. This is not about partisan politics. This is about the lives of our people. It's part of why, as this hearing was announced, we actually reached out to staff on the majority to say, please, let's do this in a bipartisan way. This is not a time for showmanship. We have proposed real solutions. President Biden has put together a task force and various asks. He's transmitted them to Congress. The Senate has already worked in good faith to negotiate a bipartisan solution to increase border security funding, to bring more technology to the border, to try to help address interdiction issues. In New Mexico alone, we have had 574 deaths just over the last couple of years from the fentanyl crisis, and those are just the ones that are reported. When I'm home every single day, I hear stories from our law enforcement, our first responders, our tribal leaders, our mayors, and our healthcare providers who are seeing the firsthand effects of these issues every single day on the ground. We know that these issues are affecting our tribal communities disproportionately, whether it's the lack of healthcare infrastructure or the lack of funding that's been provided through BIA law enforcement and other tribal services. We know that Congress has to act, and I implore my colleagues to help address this issue. But I also think it's important that we talk factually about how fentanyl is coming into the United States and how we are actually seeing this surge happen. We know the facts are very clear on this, that 90% of fentanyl is coming into the United States across legal ports of entry. It is being trafficked by the cartels, but it is mostly American citizens who are being recruited to transport those drugs. We know that once it comes into our communities, it's being distributed largely through existing drug networks, and we know that many of our family members are ending up in dire consequences as a result of that. We know the solutions. The solutions require that we do address the flow of drugs and raw materials coming into this country. That means more border patrol, more support to catch fentanyl at our ports of entry. It means interdiction in our communities, partnerships with our tribal, federal, local law enforcement to actually get drugs and those who are trafficking them off the streets. And the third is recovery, because our communities are struggling, especially in our lowest income communities. And if we do not have the behavioral health infrastructure to help people who are struggling with addiction, they will die, because we see it every single day. We've been working across the aisle to try to create a fentanyl prevention caucus, to try to pass legislation, to try to get funding into the budget to do that. And one of the things I would love to ask the chairman and my friends across the aisle is to join me in asking Speaker Johnson to put forward emergency funding for Border Patrol to help address the flow of drugs into the United States. It's something that we've tried through the emergency supplemental that is still stalled out on the House floor. I implore my colleagues to help address this question. Finally, I want to hear from our guests who are here today about what you think that we need to be doing here in Congress to address this issue. We know it's serious. We take the lives of your communities very seriously, and we deeply appreciate you being here today to testify. And with that, I yield back.